We begin with some good news and another glimmer of hope in the fight against COVID-19. Anyone in this country who wants a coronavirus vaccine will be able to do so by June. That is according to the Army General leading Operation Warp Speed Supply, Production, and Distribution Operation. And the CDC is set to meet today to recommend who will be first in line to get vaccinated. This comes as hospitalizations continue to skyrocket across the country. As of yesterday, more than 96,000 Americans have been admitted for treatment because of the virus, according to the COVID Tracking Project. So Debra Alfarone joins us now from Washington to talk a little bit more about what's going on. Debra, who is expected to be prioritized once a vaccine is made available?
Anne-Marie, experts are saying that it's healthcare workers first, and then it's people who are in long-term care facilities. After that, they're talking about essential workers, those who are over 65, and also those with underlying health conditions.
Today, the Centers for Disease Control is holding an emergency meeting to recommend who should get the coronavirus vaccine first.
Vaccinations? That is going to be the weapon that will end the war.
Governors will have the final say, but the CDC is expected to prioritize the elderly and healthcare workers.
Of course, with the positivity rates being high, we have both staff members, nursing, as well as ancillary staff members that are in quarantine.
If the FDA approves vaccines from Moderna and Pfizer, 40 million doses could be shipped out this month.
This is going to be one of the most challenging public health distribution efforts we've seen. It's going to be hard to imagine this going off without a hitch.
It will take months before vaccines are widely available to the public.
The challenge is going to be to convince people to get vaccinated.
Dr. Anthony Fauci told Facebook CEO Mark Zuckerberg he hopes at least 75% of the country gets vaccinated.
By the end of the second quarter of the year, you could have enough protection in this country that the pandemic as we know it will be well suppressed below the danger point.
Facing record hospitalizations right now, some governors are considering new restrictions to slow the spread.
If these trends continue, we're going to have to take much more dramatic, arguably drastic action.
In Rhode Island, hospitals are full for the first time. Patients are now being sent to field hospitals for care.
Wow, those images in Rhode Island. The thing about the vaccine is we all got to make it from now until June when it's available for everyone. I look at what Rhode Island is doing. What other additional restrictions are state and local officials putting in place to slow the spread of the virus?
Well, it's interesting, Anne-Marie. Different places, different types of restrictions. So, for example, LA County, there's 10 million people there. You can't get together with someone in a different household. That's banned as part of a new restriction. Also, Santa Clara County in Silicon Valley, they are saying no sports, no college sports, no high school sports, no professional sports. In Hawaii, if you traveled out of state and you came back and you didn't get tested, they're asking you to quarantine for 14 days. And in New York City, I bet you there's going to be some new restrictions coming up soon, too.
Oh, yeah, I can definitely see it in the coming weeks, post-Thanksgiving. Debra Alfarone, thank you so much.
Thank you.